This is the adductor tendon which we have marked, and this shows the ASIS. And from ASIS going medial is the sartorius, and this line is the tensor fascial lata. We take incision in line along the ASIS between sartorius and tensor fascial lata. To palpate the adductor tendon, go below the adductor tendon directed towards ASIS and 45 degrees to the floor. Once we hit the bone, that is the neck of the femur and inside the hip capsule, we aspirate. This is the tip of ASIS, and the incision will be in the line of ASIS about 1 to 1.5 centimeters. So this is a plane between sartorius medially and tensor fascial lata laterally, and we can see a small step here which helps us to find the plane between sartorius and tensor fascial lata. So once we open the fascia, we can find the lateral cutaneous nerve of thigh lying between sartorius and tensor fascial lata, and we retract the nerve medially. Once we retract the sartorius and tensor fascial lata, below that lies the rectus femoris muscle attached to AIS. You can either go lateral to rectus or medial to rectus. Here we are going medial to rectus. And once we retract the rectus, we see a shiny layer below that, and that is the hip capsule. Take this. So this shiny white layer which you can see here is the capsule. Once we see the capsule, we confirm by piercing the capsule and aspirating. But nothing is here since I have already aspirated from the medial side. Capsulotomy. Ideally, we make a cruciate incision and excise a part of the capsule. And we direct the blade laterally away from the medial structures which lie on the medial side. Once we do the capsulotomy and open the capsule, there is a serous fluid that is coming out of the joint that confirms that we have opened the joint. Rotate. Start. Suction. Keep rotating. Faster. Put the pointed one in.